Welcome to Orange County Car Injury Clinics right here in Santa Ana, California. Let me share with you how we help with neck pain, specifically neck pain as it relates to car injuries. So what happens is what we focus on, there's four big categories that really patients need to be paying attention to. One is the diagnostics, two is therapeutics, three is documentation, and four is trial testimony. So all four of these categories are very important if you've been involved in a car injury. And in other words, they're important that the doctors have had extra training in all of these categories. And let me share with you what I mean by that. Number one is diagnostics. So you want to be able to go to the doctors that do what's called high sensitivity testing. In other words, they actually do the test looking for very specific injuries. So that takes typically extra testing. It's not typically taught in medical school or chiropractic college for car injuries. So that becomes very important. That's called high sensitivity, high relevancy diagnostics. So that's where it starts. And I'll give you an example. I remember one time a patient came in, they went to the emergency room, they took stationary x-rays, which was not the test that should have been done for that patient that was involved in an auto accident. They didn't do any motion studies with the x-rays at all, and that's what should have been done to evaluate subligament damage in the spine, because that's typically where the problems are most of the time. So that wasn't done. Then they did a battery of blood tests. Well, the patient didn't have a blood problem; they were hit by another car. And then they did an EKG, and so they did what's called all non-sensitive, non-relevant tests. But that was their protocol for the emergency room. And then they gave the patient pain pills and sent them on his way. So they didn't do any test, any what are called sensitivity relevancy test for that mechanism of injury. That's not how it's done. So that's what we had car injury at the Orange County Car Injury Clinics. We do the four big categories. We do high sensitivity, high relevancy diagnostics, number one, to find out exactly what the problem is and the degree of the problem. Number two is we do what's called therapeutics based on the three phases of healing, and this becomes so unbelievably important because it not only increases the likelihood of you getting back to normal, but it decreases the likelihood of you having a permanent injury to some degree the rest of your life. As an example, there's three phases after you're in an injury, especially a car injury, that you'll go through. One is the inflammation repair phase. So typically that therapy is geared toward helping decrease pain, inflammation, muscle spasms, things like that. Okay. And there's a whole therapeutics that we use for that. And then the second phase of healing is the repair phase. That's where the body puts in scar tissue. Now that becomes very important because the therapy that is required for that phase of healing is physical medicine, such as chiropractic, that actually treats all three ranges of motion. All your joints, your neck and your back, have what are called three ranges of motion. It's active range of motion, passive range of motion with overpressure, and joint motion. Now, a common mistake that we see is that's not being treated in the repair phase, because that's when the body is starting to heal with scar tissue. But a lot of times the patients are giving medication, which is fine when you're in the inflammation phase, but there's some medication that inhibit collagen synthesis or the healing process. It actually inhibits the healing process. So one of the worst things that can happen is to not only not get physical medicine in all three ranges of motion, but then also take medication during the repair phase that inhibits the scar tissue healing. In other words, your body from healing. So that's what we do. That's very unique and different to other healthcare providers. And then the third phase is what's called the rehabilitation phase. And what we do there is we need to make sure we get stretching in and a little bit of strengthening, because if you don't, that's what leads to a permanent injury to some degree the rest of your life. So when we get the stretching, it helps increase the mobility through all three ranges of motion and the strength through all three ranges of motion. And that is what helps get you all the way back to normal with your activities of daily living. So you can, as an example, so you can work fully, you can bathe, shower, get dressed, sleep, all those types of things. You can get those back to normal with no pain or restrictions. That's how that works. Okay, so those are the two categories. The third category is the documentation category. Now this becomes very important for the car injury victim, is there's got to be really good documentation to help support the injury or the case. A lot of times there's cases involved and attorneys involved with these cases. So there has to be really what's called high sensitivity documentation. And that, again, that's specialty training that's taught outside of med school or chiropractic college. That the average chiropractor or the average medical doctor just doesn't know and doesn't do. And then that's called the high sensitivity documentation. And then the fourth category is willing to do trial testimony. You'd be surprised how many doctors are not willing to testify. In other words, help their patient with this injury and help to be able to explain this injury in court. You'd be surprised how many doctors are not willing to do that. Well, the Orange County Car Injury Clinics are not only willing to do it, they've been trained in how to do it. So these are the four big categories that are so important with car accident injuries. It's doing the high sensitivity, high relevancy diagnostics 1. It's getting therapeutics in all three phases of healing. And number 3 is the documentation to support that potential injury if it does end up having a permanent problem. You need good documentation to support it. And then willing to go to court and testify to the extent of the injury. All those, you see, all of those they're not taught typically in chiropractic college or medical school. You typically have to go to seminars and certification and things like that after you graduate. And that's what our doctors do at Orange County Chiropractic Car Injury Clinics, Orange County Car Injury Clinics. So that's what makes us so very unique and different relative to treating car injury related back pain, neck pain, all those types of things, disc injuries. So give us a call. We have a medical team we work with that supports the whole category. Give us a call. Again, if you've been involved in an accident, your insurance covers it 100%. So there's no cost to you. When you do call, we'll see you that day or the next day. So we'll get you in quickly. 1, 2, when you do come in, you'll see the doctor within 7 minutes. We have what's called a 7-minute wait policy. In other words, you won't wait more than 7 minutes of your scheduled appointment because we respect our patient's time. When you do come in, it'll only take about 20 or 30 minutes, so we don't keep you there a half a day. So we pay a lot of attention to you fast. And we open as early as 9, close as late as 6, so you don't have to take off work. You can come in before work, you can come in at lunch, you can come in after work. That's how it works. So give us a call. We can get you in either today or tomorrow pretty quickly, get this thing turned around, help you feel better fast, decrease the likelihood of you having a permanent injury, get you back to fully where you can do all your activities of daily living, and document and support your case if necessary. So give us a call. Schedule your appointment today at 949-207-7117. That's 949-207-7117.